skill enhancement.
It's a week-long conference as radiologists, oncologists, and relevant stakeholders discuss a disease described as the leading cause of death in Nigeria, cancer.
The keynote speaker.
They are gathered for this critical meeting at the conference center of the University of Ibadan, the Oyo State capital, where the Vice Chancellor sets the tone for the discussions.
The social, economic, and healthcare system factors that influence cancer outcomes in Nigeria. And the goal is at identifying actionable solutions. That this conference will also dwell on promoting access to cancer care facilities. And this is aimed at ensuring equitable access to high-quality cancer care to all Nigerians, and that it will be a priority. That it will also explore innovative approaches to overcoming barriers to care, including geographical, financial, and systemic challenges.
The conference submits that the fault lines in the prevention and control of cancer in Nigeria seems to widen with time, and this portends an immediate and clear danger if not confronted.
The National Strategic Health Development Plan 2 recommends elimination of financial hardship at the healthcare provider points through the operation of National Health Insurance Fund, which provides a basic minimum package of health services for all Nigeria. The package comprises emergency care, treatment of diabetes, hypertension, routine immunizable conditions, care of illnesses among children below 5, emergency obstetric and newborn care, labor and delivery, elective cesarean section and antenatal care. These interventions should include comprehensive care, cancer care, to ensure access to quality and affordable care.
The impact of cancer on mortality and morbidity rates in the country underscores the need for development of effective treatments, improved access to cancer screening and early detection, cancer prevention, as well as strengthened healthcare systems to address cancer care disparities across Nigeria. Some of the gaps identified at the conference include fundamentals, like the enrollment of medical students who should be encouraged to choose the field of radiology and oncology as a specialty. The conference hopes to close this debilitating gap across Nigeria.
How do we get them to really understand that the federal government has provided some measures for them to be able to go to certain centers and access their treatment either free of charge under the National Cancer Health Fund scheme or through a structured payment through the NHIA or through the NCAP payments where the prices of drugs are really at a reduced price.
At the end of the conference, the submissions made would be transmitted to policymakers and those saddled with the implementation of such policies. The hope is that cancer prevalence indices would improve for the better to achieve universal health coverage for cancer care.